रेडियो सिटी 91.1 पर मैं हूं आदि, ये तो आप जानते ही हैं। लेकिन क्या है कि जीवन में ना फन के साथ साथ बहुत जरूरी होती है सही इंफॉर्मेशन एंड कुछ सीरियस मुद्दों पे बात करना। और इन दिस वीडियो वी हैव अ वेरी 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 स्पेशल गेस्ट एंड थैंक यू फॉर कनेक्टिंग विद अस। एक बार आप अपना इंट्रोडक्शन दे दीजिए सबको।
Hi, hello Adi. Thank you for having me on the show. I am Dr. Vaibhav Kapoor. I am a surgeon and co-founder at Pristine Care.
एंड सर मतलब वो कहते हैं ना सिर्फ नाम ही काफी है, तो जब आपने प्रिस्टीन केयर का नाम लिया तो यस नाम ही काफी है, क्योंकि सर बड़े इंपॉर्टेंट मुद्दे पे बात करनी है। इसीलिए मैंने स्टार्टिंग में यही बात बोली थी कि लोग इसके बारे में बात नहीं करना चाहते। तो टू
Right.
स्टार्ट विद सबसे सिंपल सवाल यही कि ये पाइल्स क्या प्रॉब्लम है, ये कि क्यों इतनी तेजी से फैल रही है, क्यों इसके बारे में अब बात करना शुरू हो चुके हैं लोग। सो वी विल स्टार्ट विद
Right. Right. So Adi, like you said, piles एक बहुत ही कॉमन बीमारी है और बहुत सारे लोग इनफैक्ट अपने फैमिली मेंबर से भी इसके बारे में बात करने में शर्माते हैं. Right. So just to make things clear, without going into the medical terminologies, एक आम भाषा में पाइल्स हमारे लेट्रिन के रास्ते में होता है. लेट्रिन का रास्ता हमारा लोअर मोस्ट पोर्शन ऑफ आवर डाइजेस्टिव ट्रैक्ट, इसको हम एनल कैनाल भी कहते हैं. इट इज 3 सेंटीमीटर्स इन लेंथ. एनल कैनाल के अंदर हमारे कुछ ग्लैंड्स होते हैं जिनको हम एनल कुशन्स कहते हैं, और उनको ब्लड मिलता है थ्रू ब्लड वेसल्स. अब इन ब्लड वेसल्स पे जब भी स्ट्रेन पड़ेगा किसी भी वजह से, इनमें सूजन आएगी. सो इनकी सूजन को हम पाइल्स कहते हैं.
इस बारे में तो कभी बात नहीं होती, तो मेरे को हमेशा से लगता था कि इट ओनली हैपेंस इन मेल्स.
राइट. नहीं, ये इनफैक्ट ये मेल्स और फीमेल्स दोनों में होता है, एंड इट कैन हैपन अक्रॉस एज ग्रुप, इवन यंगस्टर्स, मिडिल एज, और ओल्ड एज पीपल. सो एनीवन कैन हैव पाइल्स एट एनी स्टेज ऑफ देयर लाइफ. वैसे तो इसके होने के बहुत सारे कारण हैं, बट मेजरली वी डिस्कस द टॉप 4-5 रीजंस. फर्स्ट रीजन इज क्रॉनिक कॉन्स्टिपेशन. जैसे ही आपको कॉन्स्टिपेशन होता है, यू स्ट्रेन मोर. स्ट्रेन करने से इन नसों पे ज्यादा जोर पड़ता है एंड दे स्टार्ट टू स्वेल, जिसकी वजह से पाइल्स हो जाता है. राइट. सो क्रॉनिक कॉन्स्टिपेशन इज द नंबर 1 रीजन, whether in males or in females. Then of course, when we have lack of fibers in our diet, right, that is also one of the reasons. जो लोग पानी कम पीते हैं, ठंड का मौसम चल रहा है, लोग पानी कम पी रहे हैं, one of the reasons it will lead to constipation, and then it can lead to piles. Okay. Normally in females, who are pregnant, especially in later stages of pregnancy, जब यूट्रस का साइज बड़ा होता है, it puts pressure on the intestine, और उसकी वजह से भी constipation होता है. And most of the females during their pregnancy end up having piles, although after delivery वो धीरे धीरे automatically regress हो जाती हैं. Then also people who are chronic smokers or chronic alcoholics, they are also having an increased tendency to have piles.
एक सवाल होता है for any disease that what do I do? Do I change my lifestyle so that I don't get into this problem?
So see, piles can be graded into 4 things, grade 1 to grade 4. So normally grade 1 and grade 2 are considered as initial phase of piles. Now in the initial phase, if a person is conscious enough and takes relevant precautions, the piles can completely go away, and you'll never have to think about surgery. So जिसमें main चीजें आ जाती हैं, one is your diet, right? So you have to ensure that you take high fibers in your diet, right? It should have lots of fruits and vegetables, and green leafy vegetables as well. Right. Second is drink lot of water, at least 3 to 4 liters of water every day, right? Now one of the reasons also for having piles is prolonged sitting. So normally people working in corporates and IT, they have to sit for long hours. Correct. So generally they are advised कि या तो आप एक soft cushion अपनी सीट के नीचे रखिए, और try to get up every 30 minutes, have a walk for a minute, and then come back and sit. So the moment you avoid sitting for long hours, it can automatically regress back. And then there are certain remedies, certain gels, jellies, or ointments which you can apply in that region, and they will help to regress the piles. So in initial phase, if these precautions are taken, piles will go back to zero.
And as you have mentioned about Pristine, ये मैंने भी पढ़ा है, patients first, and मेरे ख्याल से you live up to that expectation, because from the time anyone is there till the post surgery के बाद भी after some time, the guidance is complete taken care by Pristine. So please, if you can tell us more about that.
So see, there are two things here. One, surgery, whether it is traditional or it is modern, word surgery creates fear, in the patient and as well as his attendants. Second, average person would probably go for a surgery once in his lifetime or less. So generally ये जो पूरा procedure है, the entire journey is not very clear to everyone because it is not a routine thing which they are going. So sometimes it is very cumbersome for them, sometimes it is non-transparent for them. So what we have done here is, every patient who calls Pristine is assigned a Pristine Care Buddy, which is a sort of a personal medical coordinator. So the moment you call Pristine, this guy will pick up your phone, he will listen to your problems, और फिर ये आपको आपके नियरेस्ट प्रिस्टीन क्लिनिक में कनेक्ट करेगा जहां पर हमारे एक्सपर्ट सर्जन्स बैठे हुए हैं. So he will help you book the OPD. Once your OPD is done, if your surgeon has suggested that you have to undergo a surgery, वो सर्जरी से पहले जितने भी प्री सर्जिकल टेस्ट वगैरह होते हैं, laboratory test, radiology test, everything will be helped by you, by this guy. He will be the one who will collect your reports. आपको खुद जाकर रिपोर्ट कलेक्ट करनी नहीं है, right? Now your reports are there, everything is done. For surgery, if you have insurance, so the entire insurance clearance will be done by this guy.
I was about
to
say, is it
while you will be so while you are sitting at home, all your paperwork in the hospital will be done by this person, right? Patient doesn't have to go every time to the hospital just to check mera insurance ka approval aaya ya nahi aaya, financial approval aaya ya nahi aaya. Now, on the day of surgery, this guy will help book your cab. So Pristine cab will come to your place. They will pick you up from home, they will drop you to the hospital. Inside the hospital, even if there is a waiting line in admission, Pristine Care's patients will have a prior admission done one day before. Okay. So hence, your waiting time at admission counter is almost negligible, right? So you go to your room, your surgery happens, everything is done. Post surgery, again, this care guy is going to help you in your final billing and discharge. Normally in India, discharges take a lot of time. Yeah. How do we speed up the discharge? How do we, ensure that the billing is very transparent? So all this thing is done by him. And once that is done, फिर ये आपको again Pristine cab में घर drop करेंगे. And post surgery, whether you want to follow up once या 5 बार या 10 बार आप वापस आके दिखाना चाहो, every consult is free. And this care buddy, will help you meet the doctor again.
माल की बात है. So because of laser treatment, Pristine ने physical pain भी कम कर दिया. Yes. Because of the buddy, Pristine ने जो mental pain था वो भी कम कर दिया. And right, because of the commercials that you're saying, Pristine ने जो financial burden था वो भी कम कर दिया. Pristine का यहाँ पे आता है role when someone is suffering from this. अब Pristine care की बात करते हैं. So surgery, क्या क्या treatment मौजूद हैं? Let's talk about that.
Right. So see, if this problem of piles is concerning you almost every month, यहाँ ये already grade 3, grade 4 stage में पहुंच चुकी है, right? That's the time when you have to start thinking about the surgery, right? Initially, there was a traditional method of doing the surgery, which was open piles. जो हमने अपने grandparents और parents से सुना है कि piles को काट दिया, and it would lead to a lot of pain, bleeding, and all that part. And then gradually over a few years or so, it will again come back. Now, the latest advanced techniques have come in, which includes laser. Now, what happens in a laser treatment is, one, the procedure time is hardly 15 to 20 minutes. Okay. The part is, the laser is like a nib of a pen. So there is no cuts in this procedure, right? You don't have to do any dressings post-operative. And since cuts nahi hai, isliye jo pain hai, that is, relatively very, very less as compared to a traditional method. So I think Pristine alone in last 2-3 years would have done close to 20,000 plus surgeries in laser. So Pristine is a center of excellence in this, and I don't think so, probably if not the highest, we would be amongst the top 2 or 3 who would have done these number of surgeries in India in last 2 or 3 years or so.
And how expensive is this, or how how difficult it is to get it done?
So see, since now the surgery is happening across 40 cities in India, from traditional surgery, it might be hardly, you can say maybe, expensive by 20%.
Okay.
But with Pristine, since we are, our focus is patient first, we are doing it at a very, very nominal rate and very affordable rate. At certain places, the cost is, equivalent or even lesser than the traditional method.
अगर किसी को कांटेक्ट करना है प्रिस्टीन केयर पे तो कैसे करें?
So see, you can just go on the website, and search www.pristinecare.com. You will, as per your city, have a Pristine Care helpline number where you can, go and click and, call us. Yes.
Okay. And just to all the viewers, it is PRISTYN.
CARE, yeah.
Pristine Care. But anything that you want to say to all our viewers right now?
I think, don't fear of surgery. Surgery को delay करने से problem दूर नहीं होता. The moment you delay the surgery, it becomes more complex. It becomes more complex for you. It becomes more complex for the surgeon who is doing it, and it also increases your recovery time. So if anyone has advised you, and you are sure there is no other option, get it done at the earliest.
And as you mentioned it before, आपको चिंता करने की जरूरत नहीं है because patient first है Pristine Care के लिए.
Absolutely.
इस पूरे कॉन्वर्सेशन को अगर मैं एक रैपिड फायर में वाइंड अप करना चाहूँ, जहां पे हम वही सवाल पूछे जो हमने अभी तक बात की है, सो यस या नो में आप मुझे जवाब दीजिएगा, ठीक है?
Surely.
तो द फर्स्ट इज, कुछ लोगों का मानना है कि लॉन्ग सिटिंग से पाइल्स होता है, यस और नो?
लॉन्ग सिटिंग से पाइल्स होता है, यस.
ओके. क्या पाइल्स पेशेंट्स को एक्सरसाइज नहीं करनी चाहिए?
Moderate exercise is fine, but don't lift heavy weights.
ओके. क्या मसालेदार या तीखा खाने से पाइल्स होता है? बढ़ता नहीं,
Yes.
होता है.
Yes.
ओके. क्या जवान लोगों को ही पाइल्स होता है?
It can happen across all age groups.
ओके. प्रेगनेंसी के दौरान या कि प्रेगनेंसी की वजह से भी पाइल्स हो सकता है?
100%. Yeah. During later stages of pregnancy, when the uterus grows और वो intestines पे जब pressure डालता है, so constipation होता है और उसकी वजह से female को during later stages of pregnancy piles होने के काफी ज्यादा chances होते हैं.
Thank you so much, and it was wonderful talking to you.
Same here. Thank you, Adi. Thank you for having me on the show. Bye.
Pleasure.
Thank you.